Very much for this very nice introduction. So I will show you a video on mini-phlebectomy. The video should start, it's okay. So precise skin marking is performed before the surgery, ideally by the surgeon. The place where the vein is felt under the skin is marked by dots, which is easier for catching the vein. We use a pump for the tumescence infiltration with a mixture of 5 ml of isotonic bicarbonate 1.4% plus 140 milligrams of lidocaine and 0.075 milligram of epinephrine. The tumescence infiltration is performed all around the skin marking, so widely around, with movement forth and back to reduce the subcutaneous hyperpressure and the pain of injection, and also for infiltrate the secular zones with one puncture. The tumescence allows not only the anesthesia, but also drive the blood out of the vein, limiting dramatically the bleeding. Consecutive pricks are not painful because performed in an area already infiltrated. The incisions are made with 18 gauge needle by a circular move back. Thanks to the bevel of the needle, a skin flap is made, allowing a perfect cosmetic result. And the skin flap facilitates also the penetration of the Muller hook that we use and the catching of the vein. You can also use the hook to pass under the vein, which permits you to divide the two segments of the vein. Most of the time, the hook doesn't catch the vein only, but also fibers which are around the vein and stop the extraction of the vein with the risk of vein break. So it's a key point to cut the fiber on a hook, allowing the vein release. And you need loops to differentiate the fibers and the vein, and you see that as soon as you have cut these fibers, you have the release of the vein. It's really a key point. The vein is cut between two clamps, and we do a ligation on the proximal clamp at the beginning of the phlebectomy. Pulling the clamp in order to feel the vein under the skin like a tense string helps to guide the next incision in addition to the skin marking for an easier catching of the vein. Again, cut fiber to get the vein release. And you need loops for that. Apply a longitudinal tensil for the vein extraction. Helps to remove the vein in one piece, avoiding a rupture of the vein between two incisions to get the perfect result from a cosmetic point of view without any bleeding, as you can see. So, to summarize step-by-step phlebectomy, mini-phlebectomy, do the skin marking before, do a large tumescence infiltration, made an incision flap with the needle, catch the vein with the hook, cut the fiber for the vein release, and apply a longitudinal tensil for the vein extraction without rupture. Thank you very much for your attention.